Body-based consciousness is the idea of treating body as mind. When paired with music therapy interventions and techniques, can be a powerful tool for overcoming stress, overcoming loneliness, which is the greatest disease of our day. Here we'll look at a somatic speaker intervention and see how this works. So I'm going to talk about somatic speaker intervention, and this is something you're just using music by itself, but you're using it to experience music in a new way and experience your body in a new way. So there's this complex dynamic interaction. When music plays, it causes a disruption in the air, and all these frequencies are basically vibrational patterns in the air that disrupt the physical space and then go into our ears. Our ears basically transform those vibrations into electrical activity, distribute these messages all throughout the brain, which distributes it all throughout the body. And when you have something this complex, it's a very complex interaction. Music is a very complex physical phenomenon, and the way our body, the way our minds register that is very complex. So there are different ways of playing with this, and I've set up an example right here where I have these studio monitors, and they're the equipment I own with the richest frequencies and the most the highest quality sound. And so you want something that has the highest quality sound, whether that's a guitar amplifier, which you can play music through, whether that's a very expensive fancy speaker that you borrow from somebody. It could be your dad's old speaker set from the 80s. It could be anything that has a rich sound to it. And then when you're working with an individual, you want to position this into a part of their body that they're going to focus on. And I'm not going to play anything out of speakers right now. This is just for a demonstration. But you want to have it directly in front. Sometimes, since we feel so much emotion and feel so much music in our chest and our heart, I'll position the speaker directly in front of their heart. And as you listen to the music, the way we normally listen to music is we listen to the lyrics, we listen to the words and how that applies to our own life, and we feel the rhythms, and we tap our toes, and we do these subconscious things. But you want to challenge somebody to listen to the music in a new, dynamic way, and the way you prompt that is, I want you to sit, I want you to relax, have a alert, attentive posture. But as this music comes out, and it might be something that someone's heard many times before, I want you to focus on how these sound waves are hitting your heart, or hitting your chest, or whatever body part you're focusing on, and observe your body's response to that. So you want to explain all this before you actually listen to the music, because you don't want to disrupt the musical experience with your talking, with instructions, with directions. You want to have all this very clear beforehand, because ideally, when this takes place and the music plays, you want it to be quiet, and you want them to be fully concentrating on that experience. So pay attention how these sound waves affect your heart, which it may not. It may be the actual way the sound waves are translating in our brain and affecting our heart. But this visualization is what enhances the experience. It may also create a resonance, who knows, but when you're engaging that idea of how this sound is affecting your heart, you're engaging someone's creativity, you're engaging their imagination, you're engaging their enhanced consciousness awareness of what's going on in this experience. And some further instructions. So feel how fast your heart beats in response to this. This may take some practice beforehand. I work with many people, like we were talking about with blocks, or some people are very disengaged with their bodies because of trauma or because of certain physical conditions. You may have to work your way up to this intervention. But that's one way to enhance what's going on. Feel how fast your heart beats or how slow your heart beats. Notice if you have any feelings in the pit of your stomach, and that could be adrenaline. Someone gets excited. Your adrenal glands are right on top of your kidneys. Pay attention to any warmth, any perceived warmth when you feel this music, when you hear it. And so the whole point is you're not listening to the music up here. You're not listening with your head. You're listening with your full body mind. And then you play the music. It could be something like a 3-minute song. It could be a 20-minute classical piece. It just depends on what your client or individual, where they're at. You listen to the whole piece, and then you can process it afterwards. So what was that like? Was it difficult or easy? Did you feel like you got anything out of it? What did you feel? What did you imagine? Some people have these automatic imagined visualizations of like blue light entering their soul, which they feel like is in their heart. It could look so many different ways, and so you're not trying to get somebody to change their minds about why this works or not, or how this works. You're getting curious and you want to know more about their experience.